Okay, hi everyone. Welcome to our sixth episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital's experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. In support of Sexual Assault Awareness Month, today's guest is Pam Crues, an advanced practice nurse practitioner who leads our medical legal exam team here at Nashville General Hospital.
30 years ago, Nashville General Hospital stepped up when the community realized a need for experts in the field of sexual assault. Up until a few years ago, all sexual assault victims 16 and older were treated here at Nashville General Hospital. In collaboration with the Mayor's Office, the Sexual Assault Center, Metro Police, and the District Attorney's Office, victims can now be seen at various locations throughout Nashville by our expert medical legal exam team. For younger children, our kids, an affiliated clinic of Nashville General provides expert medical evaluations and crisis counseling in response to concerns of child sexual abuse. Their information can be found in our comment section below. Let's jump into our program with Pam Crues. Pam?
Hey, good afternoon. Thank you guys so much for asking me to come today about this important subject. April is Sexual Assault Awareness Month, so I'm really glad to be here. I feel like people are like, that's a really strange topic to have, sexual assault, but it is so prevalent in the community, and it's such a topic that needs to be at the forefront of everybody's mindset. So again, I'm glad to be here. I'm so thankful that over 30 years ago that General Hospital had the foresight to form a medical legal exam team led by advanced practice nurses. Consistently, we have provided sexual assault exams for victims age 16 and up that have occurred in Davidson County, and now the surrounding counties, all of Middle Tennessee. Predominantly, we usually do, most of our exams happen on females, except now that we're starting to see, as we've talked more about sexual assaults, that we have more male victims coming forward and members of the LGBTQ community. So we want to just encourage anybody, if you're the victim of a sexual assault, please come forward to General Hospital or to one of our other clinics. We are lucky to have a partnership with Our Kids in Town, who sees child victims ages 0 through 15 years, and my team serves the victims who are age 16 and up. We have 7 nurse practitioners. Someone is on call 24 hours a day, 7 days a week to provide care to victims of sexual assault. Our goal is to provide medical legal exams. Our number one concern for taking care of a victim is we want to take care of them medically. Do they need some type of medical attention because of some injuries that they have sustained? Do they need treatment for possible STD exposure, pregnancy exposure, or HIV exposure? We also want to help them in the legal perspective, and we do this by collecting sexual assault kits. No two exams are alike, depending on what the victim has told us has happened, and the time frames involved depends on the type of exam they will get, and then it'll also impact what medicines they may be offered. We always enjoy working with the police, but here in Tennessee, we have a fairly new law that if you're ages 18 and older, you do not have to have police involvement for a sexual assault exam. You can have an anonymous kit collected. So if you're age 16 and 17, we will be seeing you with the police. Our time with victims does not stop when we have just the exam. If we are needed to testify as an expert witness in criminal proceedings, we are more than happy to do that too. My team has testified in a lot of criminal proceedings here in Nashville and also at Fort Campbell. So we are always available for that for our victims. We've seen a huge increase in volume over the last 5 years. Sorry, that's so distracting. But we've seen our volume has doubled. We're on track to see 400 victims this year. So over the last 5 years, our volume has doubled. This is all made possible for work with our community partners, as Kathy had mentioned. Victims are at almost all of our locations have access to an advocate from the Sexual Assault Center. And an advocate is an important role when it comes to sexual assaults. It's nice for the victims to have someone who advocates on their behalf, and also to help them get plugged in for counseling, victims' compensation, and some other things that from the medical side we're not overly familiar with. So that is a great resource, and we're so thankful for our partnership with the Sexual Assault Center. We do have a clinic. We have a partnership with the Sexual Assault Center at the SAFE Clinic. It's located in Metro Center. We do staff that 24 hours a day, 7 days a week. So if victims feel they don't need emergent care and they don't want to come to a hospital, they can go to our offsite clinic, and we are happy to meet them over there. We want to make sure that every victim is seen and treated in an appropriate manner. And again, if anybody has any questions about that, you can feel free to call our ER at 615-341-4357. We're happy to get you in touch with the nurse practitioner on call. And like I said, we serve victims from all over the Middle Tennessee area. It's nice. We feel really supported by law enforcement and by the medical community, who are so happy to have us come and meet victims and do the exams. We are seeing a fair amount of patients from human trafficking. It's kind of a buzzword out in the community today. And so a lot of people don't understand exactly what human trafficking is, or sex trafficking. Human trafficking can involve not only victims of sexual assault, but it can involve labor and that type of thing. But in sex trafficking, victims are coerced, or they are being made to go out and prostitute themselves. But there's always coercion. There's always somebody else is gaining the monetary needs from that. So that's kind of sexual assaults in a nutshell. Do you guys have some questions you want to ask me?
Thank you very much, Pam. Even just getting through your presentation during our code red, we appreciate that. See, that quality nurse, quality care. So we do have a few questions that were asked beforehand, so I will dive right into that. So as a survivor, do I have to involve the police if I come to the hospital or another location?
No, you do not have to involve the police as long as you're 18 or older. I will let you know this. A lot of times there's some confusion about that when it comes to collecting the kit. So sexual assault kits that are collected without police involvement will not be submitted to the crime lab for processing. The only people who can submit kits for processing are law enforcement. So if you come forward and you are anonymous, then we will never know the results of the kit unless you involve the police.
Thank you. And then we have a question that just came in from Candace Talley. It says, I am a registered nurse. What do I do if a patient in the inpatient setting who disclosed that they were a victim of sexual assault? What do I need to do as a nurse, and how do I become a sane nurse?
Okay, it's a really good question. So to become a sane nurse, here at Nashville General, we are one of 2 locations in the whole state of Tennessee that require advanced practice nurses. So that way our victims they only have to interact with the APN because we can write their prescriptions and all those other things that require a separate license. The International Association of Forensic Nursing, there is a 40-hour class that RNs with 2 years of experience can take to become a sane nurse. I would say if you are at a location here in town or wherever you are, the best thing to do if you have a patient who discloses they've been sexually assaulted, A, is to figure out, do they want police involvement, and B, check with your hospital policy on what that reporting looks like. Again, we get a lot of calls from hospitals around the Middle Tennessee area concerned for that. And then we can usually arrange some type of transport, maybe a hospital to hospital transport, so the victim can come here and get an exam and go back to the original hospital. So we want to try to meet patients wherever it's possible. We are not able to go to outside hospitals unless we're credentialed there.
Perfect, thank you. And then my next question simply is, so I know generally, when you have young adolescent men and women who, let's say, a college campus setting, because in Nashville there are a few colleges near our hospital, so you tend to have people that maybe an assault happened over homecoming weekend, and it's been a few weeks and they don't want to necessarily share it. They've been hesitant to share this information, and they finally disclose it. What would you say to them if their assault happened a few weeks ago? How do they get help, or is it too late to come and say anything?
Yes, that is a great question. So if an assault happened a couple weeks ago or a week ago, it's probably out of the time frame for us to collect a kit. But I would encourage any victim to come forward. You can still report to the police. You can still prosecute. If there's enough on that end of it, on the law enforcement side. On our end is we want you to come and be tested for STDs, for pregnancy. We want to make sure that you as a person are medically safe from what happened. And then we want to try to plug you into advocacy and possibly counseling. We know that the studies have shown early intervention into counseling provides for a much better outcome for victims later in life.
Perfect. Thank you. Thank you, Pam.
Thank you.
Oh, let's see.
Sorry about that. Okay, so earlier you had mentioned about victims receiving medication, and then you just also talked about pregnancy and STDs. So is that part of the medication that somebody would receive when they come into the emergency room for treatment?
Sure. So yes, we do. When someone comes into the ER, we want to go ahead and dispense pregnancy prevention medication. We will give it all to the victim while they're here. Pregnancy prevention, STD or sexually transmitted disease prevention, and HIV prevention. Now, we do have a partnership with the community, the Walgreens Community Pharmacy. The pharmacists over there work really well with our victims, helping them get, if they choose to do the HIV prophylaxis, helping those victims work around with if they have insurance, getting the pre-approvals for that, or if they're uninsured, enrolling them in grant programs. They have been a godsend for our patients and for us, and just amazing to work with in getting the HIV prophylaxis. So I'm glad. I also want to say too, whatever you have done here at Nashville General or any location for a sexual assault exam, you cannot be billed for that. So the state, there is a law that says if a patient or victim seeks medical treatment for a sexual assault, you cannot bill them. So anything done here or at the clinic or one of our other locations we serve is free to the patient.
So pre-COVID, Nashville was considered, and it probably still is right now, looking at things going on downtown, the bachelorette capital of the United States. So do you see that most of the assaults are occurring in the downtown area? And then what should someone do? Kaylin had mentioned earlier, if somebody was assaulted during homecoming week and then it took a few weeks before they wanted to come forward, well, what if it's the night of or the weekend of? Like, what's the timeline? What are the steps they need to take to make sure they do get the care and treatment and counseling resources that they need?
Sure. So yes, we are seeing a fair amount of tourists coming forward with sexual assaults. So we work, it seems like on Sunday morning, I guess after everybody's been out on Friday and Saturday night, we are seeing a fair amount of those victims. And so they are coming forward. We are collecting their kits and starting them on medicines. Again, we work with, if somebody say was going home to Chicago and they're going home today, they get their kit. We work with the Walgreens pharmacy to get their prescription transferred there for them. So we have a lot of interdepartmental agency collaboration. I think that any victims should feel very good about the services that are happening for them in Nashville. There is so much work and collaboration behind the scenes in support of victims, and it's a really, really exciting time for us. But I guess to kind of go back to the original question is, yes, we are seeing an increase with the tourists. And I don't know if, I feel like we're just seeing an increase overall. I think people are feeling much more comfortable after the Me Too movement about coming forward and talking about sexual assault. I'm old, so people my age, we just don't talk about that. But this younger generation with social media and some other things feel much more comfortable talking about these issues.
And then is there work being done with the bars and restaurants downtown so that if something happens in their location, they know to send a victim to this hospital or one of our partner hospitals? Is any of that conversation happening?
Not from our medical side, but we do work. So we have a monthly meeting that involves all of basically the players in the sexual assault world. And that also includes EMS and police. And so that information is filtered down because those are the people that are going to be on the scene. And so that information is filtered down to those folks that these people need to be directed. A lot of times, if the police are involved at the scene of a crime, of a sexual assault, they will actually call the sex crimes detective on call who will say, hey, this is the choices that the patient has to go. A kind of a cool program that the Sexual Assault Center has right now is they have a safe bar program downtown where they've gone in and done some training with the bars, and they'll have a logo somewhere near their entrance that says that they're part of a safe bar program. So like I said, lots of work being done amongst all the people.
That's great information. Thank you.
Yes, and we actually just got 2 questions in through the Facebook stream. So,
Okay.
the first question is, what are a few signs of sexual assault?
Wow, that anything could be a sign. That's a really hard question. I will say this. I see a fair amount of younger victims who maybe they're in town or maybe they're not. They're just out, they're drinking, they consume a lot of alcohol. And I'm not victim blaming. I'm only reporting the facts as I see them. And maybe they wake up the next day and they're fearful that something happened. And we see a lot of those victims. And it's okay if you don't know what happened. If you went somewhere and you woke up and your friends have told you they saw something, or you woke up and your clothes were off, come forward. I mean, we're all here to help you, and there's no judgment. This is a very judgment-free area. So come forward. Obviously, if you wake up and you have some type of injuries, it's certainly worth being checked out, whether you decide to pursue the avenue of sexual assault or just, being seen as a regular patient.
Thank you. And then next, with this question, I know that it has been reported that domestic assaults have increased during quarantining and, during this last year of us being in quarantine in the pandemic. So the question is, have sexual assaults increased during the same time?
I will say no, and I'm kind of surprised, but every year for about the last 7 years, our numbers have gone up about 20% every single year. Because of COVID, our numbers were not as high in 2020, but I certainly think that we have rebounded. We've been really busy, especially this last month or two since things have opened up. We've also started to see over the last year or two more domestic cases involving a domestic partner. Just because you're married does not give you the right to sexually assault your spouse. So we are seeing a lot more cases of that. We're also working hard to reach the hard to reach communities. Definitely seen an increase in Spanish reporting sexual assaults, and the Sexual Assault Center is working with some of the other partner agencies on reaching like the Kurdish community and some other communities. So victims feel comfortable coming forward if they've suffered an assault.
Perfect. And this is the last question. Last question. So throughout the live stream, I have heard you use the terms survivors and victims kind of interchangeably. And I know I'm 25, so I'm not too far removed from college. So I know in college, there was this huge push to only say survivors, with the Me Too movement growing, we're only going to refer to individuals that were in these situations as survivors. And, so I wanted to ask, do you feel like it's better now to use those terms interchangeably, or is there a reason why one term is used over the other in certain settings? Or as an advocate, what vocabulary should I use?
I think that's a little bit of a tough question because for many years we were taught to call victims survivors. Now lots of people are saying victims survivors. There was a little bit of a backlash a couple of years ago that some victims felt like they were not survivors, and this whole new push of wording has come through. There's nothing wrong with asking patients, and I will use patients also in there interchangeably. I don't think there's anything wrong with asking the person, like, how would you like for me to refer to you? I use that approach a lot with patients and just working with them because, I mean, above all else, I want somebody to feel comfortable with our interaction.
Perfect. Well, thank you. Thank you very much, Pam, for answering all of our questions today. And thank you for your time. This has been such an enlightening session and opportunity. So I really appreciate you. And I thank everyone who has joined us today on the session, who tuned in.
Yes.
Thank you. Thanks for having me.
Oh, sorry. Thanks, Pam. And mark your calendars for our next Wellness Wednesday event on May 5th at 12:15. It will feature Dr. Richard Fremont, our Chief of Pulmonary Medicine here at Nashville General. May is Asthma Awareness Month, so he will be speaking about that. Thank you.
Thank you, everyone, and you guys have a great day.
Thanks.